Welcome along to the deep dive. This is where we take the source materials, really dig in, and pull out what you need to know, the essentials, the key insights, basically helping you get informed without getting bogged down. Today, we're looking at a specific market forecast. The source is a detailed analysis from Cognitive Market Research, which came via Global Market Pulse.
And we're focusing specifically on the market for bedside medical dispensing systems. Our goal here, really, is to unpack the numbers in this report, get a handle on the sheer size and speed of this market's growth, and also to figure out what's driving it all, globally and in different regions.
Right, and just glancing at the global numbers here, it's pretty clear we're not talking small potatoes or slow progress.
No, not at all. It's already a huge market and growing incredibly fast. The report puts the global value at $6,932.4 million back in 2021.
Okay, so almost $7 billion just a few years ago. That's a significant starting point, but where does the report see it going?
Well, the projections are, frankly, pretty striking. It's forecast to jump to $10,600 million by 2025, so, crossing that $10 billion mark quite soon. But the really big leap is longer term. They project it reaching $24,782.4 million by 2033.
Whoa, hold on. Nearly $25 billion globally inside the next 10 years or so, from around $7 billion. That kind of increase suggests some serious momentum. What's the overall growth rate they mention? The CAGR.
Yeah, the report states the global compound annual growth rate, the CAGR, is a very strong 11.2%.
11.2% globally. For a market already that size, that's solid double-digit growth year on year for a decade. This signals more than just steady progress. It feels like a really rapid, almost fundamental expansion of these systems in healthcare.
It absolutely does. It really highlights how quickly, according to these figures, hospitals and clinics seem to be adopting this tech. It's becoming, essential to how they operate.
Okay, so let's try and unpack this regionally. The report does break it down, right? It mentions North America as the biggest slice of the pie currently.
That's right. North America brought in $2,835.4 million in revenue in 2021. So, yeah, the leading market. And the projection, going to $4,218.8 million by 2025, and then more than doubling again to reach $9,268.6 million by 2033.
Okay, still huge growth, $9 billion plus, but I noticed its CAGR is listed slightly below the global average.
Yes, that's correct. North America's CAGR is stated as 10.3%, still double digits, very solid. But yeah, a touch slower than that overall global pace of 11.2%.
So the biggest market by value, but maybe not the absolute fastest growing. What about the countries within North America? The U.S. must be the giant here.
Oh, absolutely dominant. The U.S. market alone was $2,274 million in 2021, projected to hit $7,183.2 million by 2033. That's a 10% CAGR.
Right. But what's interesting, the report seems to suggest Canada and Mexico actually have slightly higher growth rates.
It does. Canada's growing at 11% CAGR. It's projected to hit over $1.3 billion by 2033, up from about $394 million in 2021. And Mexico, according to the report, shows really strong potential. It has the highest CAGR in North America, 12.5%.
12.5%. Wow.
Yeah, jumping from a smaller base, $167.3 million in 2021, but projected to reach $695.1 million in 2033.
So that faster pace in Canada and Mexico, maybe they're, like you said, earlier in adopting this, or maybe seeing faster investment compared to the more mature U.S. market.
That seems plausible based on the numbers, maybe catching up or specific local factors driving quicker uptake.
Makes sense.
Right.
Okay, let's hop across the Atlantic. Europe. How does that region stack up? Size, growth?
Europe's also a major player, definitely. A bit smaller than North America, though. It had $2,052 million in revenue in 2021. It's projected to grow to $3,105.8 million by 2025, and the forecast for 2033 is $7,063 million.
Okay, so over $7 billion by 2033. Again, more than tripling over the period. What's Europe's growth rate? Its CAGR.
Europe's CAGR is 10.8%. So a little faster than North America, actually, and closer to that global average.
And within Europe, the report mentions the big economies, UK, Germany, France, all showing pretty solid growth.
Yes, exactly. Germany is slightly faster at 10.2% EGR, projected to go over $1.3 billion by 2033. The UK and France are just under 10% CAGR, but still expanding strongly. Projected over $1.1 billion for the UK and around $981 million for France by 2033.
And you mentioned Italy showing notable growth as well.
Yeah, Italy's growth is solid, 10.6% CAGR, expected to reach about $734.6 million by 2033. And interestingly, the report flags countries like Spain and Russia with even higher KGRs. Spain matches Mexico at 12.5%.
12.5 again. Okay.
and Russia at 11.1%. So that suggests, particularly fast adoption happening in certain markets within Europe.
Yeah.
Even the rest of Europe category shows strong growth, 11.8% CAGR. So it's definitely a widespread trend.
It's really interesting seeing that variation even within one continent. Now, the report points to one region as the absolute fastest growing overall.
This audio was created with Podcastle.ai.
Now, the report points to one region as the absolute fastest growing overall. That's Asia Pacific.
That's right. Asia Pacific is where you see the most dramatic acceleration in this market. It started a bit smaller in 2021, $1,542.5 million, but it's projected to hit $2,496.3 million in 2025, and then take a huge leap to $6,530.2 million by 2033.
Wow. Okay. From $1.5 billion to over $6.5 billion, quadrupling, basically. That's significant acceleration. What's the CAGR there?
The CAGR for Asia Pacific is 12.8%. That's the highest regional growth rate in the entire report.
12.8%. And which countries are really pushing that? China must be a major factor.
China is definitely a huge driver, projected to reach $2,566.4 million by 2033. That's a robust 13.2% CAGR. But the report specifically highlights India, calls India the fastest growing country overall, globally.
The fastest growing country in the world for this market. Okay, tell me about India's numbers.
India is projected to expand from $166.6 million in 2021 to $822.8 million by 2033. Its CAGR is an incredible 14.2%.
14.2%. Yeah, that really stands out.
It really does. It points to, rapid modernization and investment in India's healthcare sector, which the report does mention as a factor.
And the report also mentions broader adoption across Asia Pacific, Japan, South Korea, Australia.
Right. It seems to be a region-wide trend. Those other countries are showing steady growth too, mostly in the 11% to 12.9% CAGR range. But yeah, clearly led by the massive growth in China and especially India.
Okay, let's shift focus again. Latin America. What's the picture there, according to the report?
Latin America's growth is described as very promising, also showing strong double-digit expansion. Brazil is highlighted specifically, projected to grow from $132 million in 2021 to $542.8 million by 2033. That's a 12.5% CAGR.
12.5% again. Interesting how that number keeps popping up. Mexico, Spain, now Brazil.
It is interesting. And the report also mentions Argentina, Colombia, Peru, Chile, all showing strong potential growth rates between 10.7% and 12.1%. The report links this to rising investments in healthcare automation across the region.
Got it. And finally, the Middle East and Africa. What does the report say there?
For the MEA region, Egypt and Turkey are identified as key emerging markets, high growth potential. Egypt is projected to grow from just $16.9 million in 2021 to $69.2 million in 2033. That's a 12.8% CAGR.
Wow, 12.8%, right up there with Asia Pacific's average.
Exactly. And Turkey shows an 11.9% CAGR, projected to reach $168.8 million by 2033.
And the rest of the Middle East?
The rest of the Middle East market is also growing steadily. The report puts its CAGR at 11.4%, projected to reach just over $50 million by 2033.
Okay, so we've looked at the numbers globally, regionally, massive scale now, and just really rapid double-digit growth pretty much everywhere, with Asia Pacific leading the charge, particularly India. The report ties us back to some core reasons, right? Why is this demand accelerating so much?
Yes, it summarizes the key drivers. A big one is just the ongoing push for digitization in hospitals and clinics, everywhere. Fundamentally, healthcare providers are looking for better control over how medications are delivered.
And better control, I imagine, directly links to patient safety. That has to be huge.
Absolutely. Improving medication safety is listed as a primary driver. And another key factor mentioned is reducing the workload for clinical staff.
Right. Automating these systems can free up nurses and doctors from tasks they used to do manually.
Exactly. Time-consuming and potentially error-prone tasks.
That makes total sense. If these systems promise safer medication delivery and less burden on staff, you can see why the demand would spike. Did the report link these general drivers to specific regions too?
It did, yeah. It suggested the strong growth in Europe might be partly linked to challenges from an aging population there. In North America, it may be linked more to the burden of chronic diseases, which often require complex medication plans.
Okay.
And in Asia, that rapid acceleration was specifically tied to overall rapid healthcare modernization efforts across the region.
So it's kind of a mix. Universal needs safety, efficiency, better control, but then amplified by specific demographic trends or healthcare priorities in different parts of the world, all pushing demand for these systems.
Precisely. The data presented, throughout this report, it makes a compelling case that these bedside dispensing systems are shifting from being maybe a nice to have to becoming a really necessary piece of modern healthcare infrastructure. Globally, it looks like a fundamental change in how medication is managed right there at the point of care.
Yeah, this deep dive into the report's numbers really paints a clear picture. It's a market undergoing incredibly fast expansion, fueled by, frankly, critical needs in healthcare, improving safety, boosting efficiency. It feels like more than just growth. It feels like a transformation underway.
The data certainly underlines a global sense of urgency and significant investment in automating medication delivery right at the bedside.
So, given everything we've just unpacked from this report, the huge scale, the rapid global growth, and that emphasis on critical benefits like boosting medication safety and cutting clinical workload, here's something to think about based purely on what we've discussed. If the global healthcare system is now investing billions and growing this market at double-digit rates specifically for systems designed to improve safety and reduce workload in medication management, what does that potentially imply about the scale of medication errors or perhaps the level of staff burden that existed before these systems became so widely adopted? What does this rush tell us about the problems they're trying so urgently to solve?
Welcome back to the Deep Dive.
Good to be here.
Today, we're looking at something pretty important in modern hospitals, something you might actually see right by your bed if you're a patient.
Right, these bedside medical dispensing systems.
Exactly. And we've been digging into a market report on this from Cognitive Market Research. It lays out some key dynamics, innovations.
Yeah, it gives a good overview of what's going on.
So our mission really is to cut through the noise a bit. We want to understand what's really driving these things, what the roadblocks are,
The challenges.
and also the cool tech trends that are changing how meds get administered right there at the bedside.
Okay, so let's start with the basic why. Why do these systems even exist?
Good question.
Well, it really boils down to patient safety. That's the big one. And trying really hard to cut down on medication errors.
So it's not just a nice-to-have feature, it's core.
Absolutely. The report makes that clear. It's the number one driver. Safety first.
Okay, but how do they actually make things safer? What's the mechanism?
It's mainly through automation. You're basically replacing manual steps, which...
This audio was created with Podcastle.ai.
Mainly through automation. You're basically replacing manual steps, which, let's face it, are where errors creep in with system checks. So it helps ensure the dosage is right, and it builds in traceability. You know exactly who got what medication and when.
Right, that audit trail.
Precisely. And in places like intensive care or the ER, that automation is absolutely critical. It reduces that manual intervention, cuts down human error risk. It lines up with all those big global safety goals.
Makes sense. But it's not just safety, is it? The report mentioned impacts on, like, the daily grind for hospital staff, too.
Oh, absolutely. Huge impact on workflow. I mean, think about it. Hospitals are often dealing with staffing shortages, more patients.
Yeah. Nurses are stretched thin.
Exactly. So efficiency is key. And these systems, they're seen as really essential tools to, well, boost nursing productivity, make things run smoother.
Right, taking tasks off their plate.
Pretty much. Less time running back and forth to the pharmacy or medication room, less time manually checking and rechecking everything. And all that time saved. It means more time for actual patient care, the hands-on stuff, which is, where you want your nurses focused.
Right.
The report also kind of links this to the rise in chronic diseases. You've got patients with complex medication schedules.
Yeah, needing precise doses at specific times.
Right. And these bedside systems are really designed to handle that complexity right there at the point of care.
Okay, so the benefits seem pretty clear. Safety, efficiency, but installing this kind of tech across a whole hospital, that can't be simple, can it? What are the hurdles?
Yeah, that's where the challenges come in. The report points out some big ones. First off, just the cost.
The price tag.
It's a substantial investment. You've got the hardware for every bedside, the software, plus all the training for the staff. For, say, smaller hospitals or clinics, that initial outlay can be a major barrier.
And I imagine getting this new system to talk to all the other hospital systems is a headache.
That's the second big one, interoperability. It's often a real struggle.
What do you mean exactly?
Well, getting these bedside units to seamlessly connect and share data with the hospital's main electronic health record, the EHR.
Where all the patient history is.
Right. And also with the pharmacy's own software. If they don't communicate well, you end up with, fragmented workflows, information gets stuck in silos.
Which kind of defeats the purpose of efficiency, right? If you're manually entering data again.
Exactly. It undermines some of the gains.
And what about data security? We're talking sensitive patient medication info here.
Huge concern, especially now with more systems becoming cloud-based. Protecting that data, keeping it private, it's absolutely critical.
And complicated, I bet.
Very. Hospitals have to navigate really strict rules like HIPAA over here or GDPR in Europe. It's a constant compliance burden when you're adding new connected devices like these.
Okay, so costs, integration, security, those are some serious challenges. But clearly, the market is moving forward. What are the exciting things happening, the innovations?
Yeah, despite the hurdles, there's definitely progress. The report highlights a few key trends. One is really embedding barcode and RFID scanning much more deeply.
For tracking the meds.
For tracking, yes, but more importantly, for real-time verification. So the nurse scans the patient's wristband,
Okay.
then scans the medication package, and the system instantly checks, is this the right patient, the right drug, right dose,
Yeah.
right route, right time?
5 rights.
Exactly. It's like a
Yep.
built-in safety check right at the point of administration.
That's powerful. What else?
Another big trend is linking these systems much more tightly with the EHR and, crucially, with mobile interfaces.
So nurses using tablets or phones.
Right. Allowing clinicians to see medication schedules, get critical alerts, even log that they've given the medication, all directly from a mobile device right there at the bedside.
Oh, wow. That sounds like it would really streamline things on the ward.
It definitely helps put real-time info and documentation capability right in their hands, less running back to a fixed computer station.
Makes sense.
And finally, there's a noticeable shift towards more modular and cloud-based solutions.
What's the advantage there?
Flexibility, mostly. Modular systems mean hospitals can kind of pick and choose components, scale up or down, customize things more to their specific ward needs instead of a rigid one-size-fits-all system.
And the cloud part.
That often makes remote management, updates, and potentially integration a bit easier down the line.
So if we pull all this together, it sounds like these bedside systems are really becoming, well, a standard part of the toolkit as hospitals keep digitizing, trying to get safer, more efficient.
That's definitely the picture the report paints. It's becoming the norm globally,
Yeah.
even with the complexities.
Right. So given everything we've talked about, the safety benefits, the efficiency gains, but also the costs and tech hurdles and these new innovations, here's something for you, the listener, to think about. How might your own experience, specifically when you receive medication in a hospital, how might that fundamentally change in the next few years because of this technology?
This audio was created with Podcastle.ai.